All right, so I am doing my clinical case presentation. Um, I was at Essentia Health Miller Dewan, fifth floor med surg. I completed my first semester of clinicals at Miller Dewan, fifth floor med surg. My main floor consisted of 3 to 5 day post-surgical interventions, as well as some short-term rehabilitation. I was also lucky enough to spend 2 shifts elsewhere. One was observing outpatient surgery for Miller Dwan, such as charting, helping with IVs, getting them ready for surgery. And then the other shift was actually on the surgical floor in the surgical unit watching surgeries. So that was pretty cool. Very lucky to do that. Um, I am doing my SBAR on a patient on our main med surge floor. Um, just so we are clear on that. This patient came in for a splenectomy. So we have Miss Jenny, who is a 60-year-old female, full code, had a cyst on her spleen that needed to be removed, and has a family history of heart disease. Miss Jenny is a 60-year-old female who came in due to having a cyst on her spleen. She joined us on the medical surgical unit due to having a splenectomy and needed time for recovery. All of her vital signs were stable, but I did see that she had a family history of heart disease. She is out of surgery and we monitored her to ensure the first couple of days her wounds were healing properly, there was no infection, and we helped manage her medications. The reason for her surgery was due to discomfort and pain, as well as the abdominal pain, and they found that she had a cyst on her spleen. This treatment was also to prevent a possible rupture of the cyst and solve the chronic pain that she was having in her abdomen. The background, my patient came in originally due to severe pain and abdominal discomfort. Um, she was already she had already been on pain management, and when she came into my care, and her pain level was at a 2 out of 10, where previously it was at a 9 or 10 out of 10. All her vital signs were also in range and normal. This was a couple days this is a day or two after her surgery. So that is pretty regular. Um, Her temp, for example, was in range 37 degrees Celsius. Respirations was 16. Oxygen was 97 on room air. Pulse was 70 and BP was 147 over 90, which is in the normal ranges for a woman of her age. Um, for my main concern was the risk of infection due to incision sites post surgery. Miss Jenny was at a high risk of infection due to her stitches. She had two different in, two different incision sites she had to be cautious of. Um, I was able to educate her on how to shower properly. She wasn't able to shower for the first couple days, but we ensured her how to um, clean properly around the areas, not over the areas. You don't want to open the wound. Also use unscented soap. Um, the spleen for the uh, pathophysiological portion of it. Um, I have the spleen is a key feature in the role of an immune function, filtering blood and removing old damaged red blood cells and pathogens. Because Miss Jennings had this removed, she's now at higher risk for immunological impacts such as an increase of infection, abnormal circulation of red blood cells and platelets, as having the spleen removes them as the spleen removes them from circulation. Having it removed increases the platelet circulation, which also increase the risks of thrombosis as well. Risk factors that are associated with a splenectomy are trauma to the area, splenic, splenic neuroplasm, infection, abscess such as infection or abscesses that damage the spleen. And lastly would be an autoimmune condition such as refractory autoimmune hemolytic anemia. Usually post-surgery include preoperative vaccines, post-operative prophylaxis, and monitoring and educating on treatment, preventing thrombosis, and medical alert identifiers. Next, we have the assessment. Since she was post-surgery and due to her already being more than a day out of surgery, her vitals were pretty normal. She was alert and oriented, no cracks in her lungs. Her vital signs were within the normal limits, and her capillary refill was within less than 30 seconds. So that was her head to toe assessment. Her diagnostic was the cyst on the spleen, which is why she came in and due to the pain. Miss Jenny had a CT scan to provide identification of the splenic cyst. The CT scan provided great anatomical detail and is often imagery modality used. Miss Jenny's head-to-toe evaluation shows steady post-surgical state. She is alert and oriented, has clear lung sounds, normal vital signs, capillary refill is good, thereby indicating steady cognitive function, respiratory condition, and circulation. Still consistent observation of vital signs is necessary to identify possible problems such as infection or bleeding. The cyst on her spleen, which resulted in the splenectomy, raises her risk of infection and thrombosis because of the loss of immune system and raised circulating platelets. Following surgery, post-surgical care will be centered on preventing infection, blood count monitoring, and guaranteed appropriate circulation. Best healing depends on consistent awareness of changes in her state. Next, we have her medications. Yes, this looks like a lot, but it just is hitting all the points of it. So we have these 3 medications that were provided to my patient. One is an antiarrhythmic, one is an NSAID, and the other is an immunosuppressant. The first one, flecainidine, my apologies, I totally butchered that. It is prescribed to manage atrial flutters. It blocks sodium channels during depolarization in heart cells, and the side effects include fatigue, dizziness, short of breath, and new or worsening arrhythmias. Ketorolac is prescribed for post-surgical pain management. It inhibits COX-1 and COX-2 enzymes, which involve the production of prostaglandins. Side effects of that is GI issues such as diarrhea or vomiting, cardiovascular effects such as arrhythmias, headaches, dizziness, drowsiness, allergic reactions, or prolonged bleeding. And then we have azathioprine, which is prescribed for inflammation of the abdomen. It works by inhibiting synthesis of purines, which helps DNA and RNA cells. Side effects of this are increased risk of infection, GI disturbances, or pancreatitis. And then these are all the effectiveness of these three medications, as well as their mechanisms of actions and clinical uses, um, they are known to be effective. And hold on. Together, these medications address distinct health concerns with targeted and evidence-based mechanisms. Recommendations and responses. For the nursing diagnosis, I suggest that we focus on the heart disease, hypotension, and infection. Um, the medication flecainidine is instrumental in managing atrial flutters, a condition common associated with heart disease. Hypotension is dealt with by our ketorolac and is effective pain control, reduces stress response in the body, and is effective is effective because the vasodilation that is contributed. And then for infections, that is what our last medication is for, and that is just it helps because our suppressing immune activity and prevents tissue damage from systemic inflammation. And then together, these align to improve cardiac functions, stabilize blood pressure, and reduce risk for infections, so supporting the client's overall recovery and health. Then we have my reflection. So for this semester, I felt as if the experience was overall beneficial to me. I started off being very, very nervous. I remember this. I talked to many nurses before even starting clinicals, telling them how nervous I was, and they were all trying to talk me down, trying to tell me how easy it'll be. And it honestly took me about an hour to realize it was exactly what they were telling me. It's just a glorified CNA position, in all honesty. But um, obviously, that's if you stay in the hospital, if you stay on certain positions and whatnot. I would like to be a teacher at some point, maybe, or maybe specialized in some way, shape, or form. But I don't know. I have been a CNA for many, many years, and it was very, very similar, except for it was a lot more knowledge than I had had previously, which was very nice because I felt as if I could actually put myself in there and apply myself and I don't know, just get the full experience. Um, my takeaway for this semester, I realized it is all about learning and making mistakes. I need to stop being so worried about messing up. Everyone has to start somewhere. We all have been new to this at some point in our lives, and I've always questioned my confidence, but I definitely need to overcome that for next semester. Um, Definitely looking forward to next semesters as well. Just the clinicals and all the above. During my clinicals, I realized I like applying theories to practice. I learn more and progress as a nurse by applying classroom knowledge to patients' interactions. Clinicals continuously challenged and encouraged me to think critically, adapt, and learn about the medicine. Every case teaches me about something new, whether it's clinical skills or compassion, tailored treatment, or whatever it may be. I've also learned how important hospitality is in healthcare. Creating a warm and supportive environment for patients builds trust and comfort during difficult times, and these experiences make me appreciate learning and wanting to know better. Um, these were the Benedictine, how it relates to the Benedictine values. This method has shown me how to continuously learn and in a compassionate way, as well as the hospitable approach to critical and how it is critical to provide such great care for my patients. And then there are my references.